Duodenal stump. Duodenal stump. Remaining part of the duodenum after a surgery such as subtotal or total gastrectomy. Surgical correction with primary closure of the leaking duodenum is a difficult and sometimes ineffective procedure, due to patient instability, presence of severe edema, friable tissues, and dense adhesions in the postoperative period. Moreover, the possible consequences of inadequate repair can be delayed leakage, widespread abdominal contamination, sepsis, and death. Prevention of complications or postoperative care for gastrectomy, percutaneous tube, duodenostomy, an effective and safe technique for the management of continuous duodenal stump leakage. Tube decompression of the duodenum prevents blowout at the suture or stapler line. Duodenal stump blowout. Thereafter, the leakage site will usually close spontaneously within 2 to 6 weeks of stoma formation. Cf. Duodenal stump fistula.